Hello, everyone. Welcome to my Psych Talk. My name is Jackson Alvarado, and this is about psilocybin and emotional face recognition, a study on treatment-resistant depression. The article origin is provided down here, along with the authors' names: J.B. Stroud, T.P. Freeman, R. Leach, C. Hindilka, W. Wan, D.J. Nutt, H.V. Cron, and R.L. Carhart Harris. So I'm going to try to move through this as quickly and accurately as possible, because I do not have a lot of time and I have a lot of information. So let's start off with why this topic matters. Depression can change how people read the world. So basically meaning when most people hear the word depression, they usually think about sadness or low energy. This is kind of talking about how depression can affect the way people process facial expressions. So for example, subconsciously when you walk in a room, you recognize different people's emotions based off their facial expressions. If they have a frown, they're sad. If they are, I don't know how to represent anger, but if they have a smile, they're happy. And then, this study just basically asks whether treatment with psilocybin can improve that process of recognizing facial expressions because people with depression have trouble doing that. So this study in one sentence is psilocybin with the psychological support may improve emotional facial recognition in people with treatment-resistant depression. What treatment-resistant depression means is they have taken, Jesus, I can't talk, I'm sorry. They have taken at least 2 antidepressant medications and still did not improve. So it's just not about having mild sadness, it's just about people who had already gone through normal treatments and are still struggling. Credibility is offered here with the Journal of Psychopharmacology, published in 2018. The authors linked to Imperial College London, University College London, and King's College London. It's just a quick picture of the article if you want to check it out for yourself. Main question here is, I actually already went through 2 of these, but I'll explain them again. So treatment-resistant depression that has not improved after 2 antidepressants, emotional facial recognition, basically recognizing expressions in everyday life, and anhedonia, difficulty feeling pleasure or interest in things that would normally feel rewarding. And the question here is, could psilocybin assist these and just make it easier for everyone? So participants is 17 patients with treatment-resistant depression, and there were 16 controls. So the patient groups, the 17 patients groups, or 17 people in the patient group, sorry, they had treatment-resistant depression, meaning they took the 2 antidepressants, didn't help, and there were 11 males, 6 females, and the mean age was about 45. In the control group, they had no psychiatric illness, obviously. There was 11 males, 5 females, and the mean age was about 32. There's a significant difference in age, which I'll mention later, of a weakness. Method here was pretty simple. Basically, the patients completed symptom measures, basically a questionnaire, and there was 2 psilocybin sessions, separated by 1 week, 10 milligrams first, then 25 milligrams second. They had psychological support throughout all of it. Obviously, they didn't just give them psilocybin and tell them to go away. There was a follow-up about 1 week after. They completed the questionnaire again to see how the results changed. So what did they measure exactly? Well, the main task they used was called Dynamic Emotional Expression Recognition Task, just DOT for short. This is just it sounds complicated, but it's really simple. This picture depicts it perfectly. So these people are looking at this and trying to recognize the emotions as quickly and accurately as possible. So there was also different questionnaires. They had the QUIT-16, measured depression symptoms, SHAPS measured anhedonia or lack of pleasure. So here's some qualitative results that help you guys understand. There were the patients that had the psilocybin, and you can see their time recognizing emotions was very high, and there was a significant difference after the psilocybin. And then for the control group, they didn't have much of a significant change, but obviously. And then this is more focused on anhedonia. So this is just to show that the connection between faster recognition of emotional faces with reduced anhedonia, which means lack of pleasure. So reduced lack of pleasure meaning their ability to feel pleasure. Just a real important connection because it just suggests that emotional processing depression symptoms may be linked. It's not just people that got better at computer tasks, improvement connected to something real in their lives, which is their ability to feel pleasure again, which is great. So 6 strengths I provided here. For strength, treatment-resistant depression, I think that matters because, these are people who already tried regular antidepressants, still haven't improved. The other strength is that researchers use pre and post testing. This allowed them to compare the patients before and after the treatment instead of just looking at one point. They also included a healthy comparison group, which made the results understand. Another strength is the dynamic face task, which is more realistic than still photos. Obviously, photos aren't the same as real life. Discussion, openly named limitations just shows that these people are aware of their weaknesses. So weaknesses here, I named 6 as well, or sorry, 5. So there was a small sample, only about 17 patients, 16 controls. Another weakness is there was no placebo group, so the patients who they were getting psilocybin, and that could matter because, expectations can affect how people feel and how they perform. Another issue is that patients receive psilocybin plus psychological support while the control group received neither. So it's just hard to know exactly what caused the improvement. Was it just the psilocybin? Was it the psychological support? Was it both together? The study just doesn't separate that. There were also possible co-founding variables like the age difference between the groups, medication changes before dosing, practice effects from taking the same test twice, and even supportive room setting. Bottom line here is it's a great article. It looks at depression in a more complex way. It does not only ask whether patients felt less depressed, it's more of whether they changed in how they processed emotional information, which obviously connects to relationships, communication, feeling connected to the world, which is all very important. So the bottom line is that psilocybin with psychological support helped these people with treatment-resistant depression. That's great. At the same time, it's not perfect. There was weaknesses, and it didn't include placebo group. The findings are promising, but they're just not final proof. So I think I covered everything, and I appreciate you guys for watching this.